When is it safe to take your newborn baby outside, and where can you actually go? I'm Dr. Nkiru. I'm a pediatric doctor and a mom of 3, and today we're going to be talking about safety with taking your newborn baby out of the house. So this is going to vary a lot based on your family dynamics, but also based on your location. Do you have other kids, or this is your only child? Do you have any help and someone who is helping you with other kids at home? Does your baby have a medical problem they need to be seen by their regular doctor or by other specialty during the first couple of days or weeks that we're born? The short answer is this. Most pediatricians and ER doctors are going to recommend to push and wait until your newborn or your little one is at least 28 days old. I know it is hard to wait a month to leave the house, but let me explain why. According to recommendation of American Academy of Pediatrics, but also other places, any baby who is younger than 28 days old who has a fever usually gets some form of workup done, regardless of what the cause of the fever is. And by this evaluation, I mean blood testing, I mean urine testing, where we might use a catheter to get urine directly from the bladder. We also have to do a spinal tap, which is where we get some fluid from the brain, but we do that from the back of the baby. It is terrifying, it is traumatizing for families to watch their babies go through that, especially if it's avoidable. And that's one of the reasons why we usually push and say to wait at least 28 days. Babies who are that young have not mounted their own immunity to be able to protect themselves. So our assumption is that even if though it might be a virus, there might be other infection they may have picked up. So the reason why we do all this tests is to be able to make sure they're not getting any bacterial infection that we need to treat. And most of those babies who get this evaluation have to be admitted to the hospital to be on antibiotics for a certain period of time to keep them protected and safe while the results are starting to come back. So now, trying to be realistic, while I understand that a lot of families may not be able to stay home for 28 days without going out, it is probably about trying to choose wisely where you go, places that are not overcrowded, that are going to get your child too exposed and getting them at a risk of getting an infection. For instance, a new family that has a newborn as well as an active toddler, we all know that toddlers want to be outside. So you can choose going to the park or like open places where there's enough space for the toddler to run around while you and your newborn still stay secluded and away from other people. You can also choose times of the day where you know the parks or the places available to play is not too crowded. In these situations where you take your newborn and your toddler out, things you can do to protect your newborn is where you can wear your baby. Wearing your baby keeps your baby as close to you as possible and also keeps them away from people. We all know people are excited to see a newborn. People can also be really nosy. So you wanted to keep them away from people who want to actively come and touch and just kind of say congratulations. You can also use a stroller that shields them away from others while you also maintain keeping your boundaries from other people. For families who have their kids around the holiday period, this is even more of a struggle, especially Thanksgiving, Christmas, and other holidays where families get together. We highly recommend staying away from those gatherings. This is also the time when there are peak season of winter viruses, like things like RSV and influenza. So even though your baby may have picked one of those viruses that might not be severe, they still get a full workup done. Some babies also do not do well when it comes to those viruses. So if your baby is younger than 28 days old, even younger than 2 months, we still recommend staying away from other people and go to places that are open so that way you can still get your fresh air in. By the time your baby is older than 1 month old, they are less likely going to get a spinal tap done. They may still get a blood work and urine testing done if they have a fever because they're still not vaccinated. By the time your baby turns 2 months and get their first course of vaccinations, they start to build their immunity and are less likely to get exposed or less likely to get infection that will make them sicker. If you are a family that has all the resources at home, you only have the newborn currently, you have a lot of help that can help you, and you can order online. I would say the sweet spot is 2 months old after they have received their first set of vaccinations. A little modification that I will make is when it comes to winter seasons. Any baby who is younger than 6 months old is also at risk of significant illness due to RSV or the viruses. So when it comes around that time, especially if your family can order online, you can still limit the amount of exposure your babies have when it comes to other people. I always tell families it is about being selfish for you and your little one. You are the one to protect them. We always avoid them getting sick, and the only way to do that is by you limiting the exposure. Of course, if you have older kids at home and other help that comes in, you can limit their risk of getting infection by washing their hands, avoiding them kissing their little newborn, and just keeping a distance when they are sick as much as you can. If you're looking for a video on how to actually reduce or prevent your older ones from getting sick, I have a whole new video of 5 things you can do to prevent and limit the amount of times your babies can get sick, especially the ones that go to school. Now tell me in the comments how old your baby or your babies were when you took them outside for the first time, or if you have a newborn currently, or you're even expecting. Let me know